Now on the programme, we're going to bring you a story you may know all too well. NHS waiting times in England, they are getting worse across the board, but there's also a particular warning about waits for cancer patients tonight. Let's take a closer look at some of those figures. Most people's journeys start at the GP. So if your doctor decides you need an urgent referral to a specialist, the target on the left there is 93% of patients to be seen within 2 weeks. In reality, right-hand side, the figure was 77% in April. Then there's that time between seeing your GP and your first cancer treatment. The target, again on the left, 85% will have that treatment within 2 months. Here's the reality, though, only 61% were seen that quickly in the month of April. And if you've been touched by cancer, you'll know that any delays to treatment can be distressing and even dangerous. Our health correspondent, Catherine Jones, has more on this story.
Why did the NHS across England miss its targets for finding and treating cancer once again in April? There were 3 days of strikes by junior doctors. The health service is still straining every sinew to get through the COVID backlog. And also, at every step of a cancer patient's pathway, there are chronic shortages of staff. The impact is felt by people like Phil. He was told he had a tumour on his kidney, but then for 9 months he was left in limbo, not knowing if it was cancerous or not.
It was very difficult. I couldn't stop thinking about it, really. It went effectively 9 months from original results of the results of the scan right through to the ultimate treatment. So no, I was exasperated by that. In fact, I was appalled by that.
The latest figures for England coincide with a warning about the cancer workforce across the UK. Radiologists are the doctors who diagnose cancer by interpreting scans. But the Royal College that represents the profession says the UK has a 30% shortfall of these vital staff. Oncologists are the doctors who decide a patient's treatment, but the UK has a shortfall of almost 20%.
We need governments to really wake up and take this issue seriously and start investing now, making sure they're growing that pipeline of doctors, nurses, radiologists, so that we're getting people into the profession now and in the years to come, so that if any of us or our loved ones are faced with a cancer diagnosis, we can be sure that we'll get that quality care and support.
The Health Secretary insists he has grasped the scale of the problem.
There has been a significant increase in demand, and that's why we're investing more. We're investing in 160 community diagnostic centres. We're investing in the surgical hubs programme, a further 43 new or expanded surgical hubs due this year, and we're also investing in the workforce.
But clearly, that investment is not having a big enough effect yet. And so, for more and more patients, the health service is struggling to provide prompt cancer care.
As you can see, Catherine joins us now. Good evening, Catherine. I've got to say, things are going in the wrong direction. What can be done to turn things around?
Well, there's a mixed picture of promises from the government, I would say. A long-awaited workforce strategy for the whole of the NHS is finally going to be unveiled, I think, quite shortly. But a big plan specifically to tackle cancer for the whole decade was unceremoniously scrapped in February. As the Health Secretary mentioned, rising demand is the issue. That's because we're an ageing population. And also, and this is a good thing, it's because we are going to the doctor earlier to go and have things checked out. So that is good news. Doctors are also getting better at treating cancer, which is also good news. But the flip side of that is that the NHS has to keep up with all those costly treatments and all the new technology. But no, those challenges aren't new. They're not a surprise to the government. Neither is the staffing crisis new. I actually dug out a report from 4 years ago about radiologists today, and the budget being spent to fill gaps in their workforce then had trebled between 2014 and 2019. So if you could, the rot was setting in way back, and that means I think it'll take years to recover as well.